Our vascular lab is something that I developed in our practice about 8 years ago, and it has grown and evolved a lot over that time. The vascular lab is the basis for diagnosis in vascular surgery, and it's useful. It uses ultrasound to diagnose not only vein issues but arterial issues such as carotid disease, aneurysm disease, lower extremity arterial disease. And it's really important, and the technology has gotten so good in that oftentimes now people make surgical decisions based solely on ultrasound as opposed to needing to do invasive tests. And because of that, it is critical to have a registered vascular technologist running the lab as well as doing every single scan. There are a lot of places, especially at the hospitals, where the vascular ultrasound is very limited in terms of which tests are available, and they're done by ultrasonographers who also do ultrasounds on gallbladders and babies. And especially in those circumstances, it's not good enough. They don't have the skill set to be able to look at a blood vessel and the flow in it and decide if there's something wrong or not. In addition, those ultrasounds are then read out of context by a radiologist who, again, doesn't have special training like a vascular surgeon does in interpreting the findings, and again, often does it in a vacuum. What's great about our lab is that it's done in conjunction most of the time with a clinical picture, so that we're not reading in a vacuum, we're not doing the test in the vacuum, we can do the appropriate test for the patient. And so if a patient comes in and doesn't have the clinical symptoms that fit what the study is that's been ordered, we can call their referring doctor up and say, hey, you know, it might be better to get this study, this might give you the information you're looking for, and that once we need to look at those pictures and interpret the study, it's done by somebody who understands the disease process and isn't looking at one of 1,000, you know, gray and black pictures during the day. We have now, over the last 6 months, opened up a freestanding vascular lab that's just across the hall from our office, and it's headed by a vascular technologist who has been the director of the vascular lab at one of the local hospitals, because we feel that it's going to be an even higher quality of service than we've been able to offer before. And we are dedicated to providing same-day access for patients who have the need for an acute diagnostic study. For example, if there's a question of whether they have a blood clot in their leg or if they've just had some kind of a stroke, we can do all the follow-up tests and diagnostic tests for the venous patients, and we can turn around the reports to the referring physicians in less than 24 hours. We have the best equipment that's out there today, and we have the best technologists who only do vascular studies.